Hey guys, it's Dr. Abraham with A Sip of Aesthetics. We are here with Annabelle today. It's your first time on the show.
It's my first time.
Well,
Thanks for
welcome.
having me. I'm excited.
My pleasure. We're doing something a little different today. We're gonna be talking about some of the most common myths that we've seen people either tell us or we've seen online
Okay.
that are related, to Botox, aesthetics, regenerative medicine. We're gonna see if there's any merit to any of them or if they're all just kind of like made up.
Perfect. Yeah, it's a list compiled basically of patients that have come in stating these things to us or just things that we found online. So should we just read a few of them?
Yeah, let's go
All right,
for it.
Let's do it. So the first one being, if I get Botox, I will look overfilled and unnatural. I definitely hear that one a lot. Botox is used as rat poison.
Oh,
If I get filler, I can look like Kim Kardashian. I can change the shape of my lips with filler. Botox kills the center for empathy in your brain.
wow.
Maybe that one's true. RF microneedling melted my filler. And Botox will freeze my face and I will have zero emotion. What are we thinking about these so
No,
far?
those are some nice ones. We can definitely go through some of them and talk about it.
Gosh.
I like the Botox is a rat poison one.
That one's fun. I like the one too about it's going to kill the part of your brain for
Yeah.
empathy. That one's interesting too.
Yeah, I don't think it usually kills your brain, no.
I would say not.
Well, it's similar in the sense to the rat poison one. But I would say that would make a very expensive rat poison. So that's the first thing. If you have
Definitely cheaper
Botox,
stuff
exactly,
to kill
there are
rats.
cheaper alternatives.
For sure. I will say one though, the one that says if I get Botox, I will look overfilled and natural. I do hear that quite a bit with patients when they come in, and it's typically patients that are first time patients with us, and they get nervous to do Botox because they feel like they're gonna look unnatural, overfilled. And I feel like this is a misconception because people are confusing Botox and filler, thinking they're the same thing when they're actually two completely different things. So that's definitely one thing that I feel like does get brought up quite a bit in the treatment rooms. What about you, Dr. Adam?
Yeah, no, I agree. And part of the reason fillers fill volume. Now, even filler can look great and can look natural, but if you use too much filler, you can overfill. Botox relaxes the muscle, so it's not gonna, overfill. Can you use more Botox? Can you use too much Botox? Sure, but it's not gonna give you that overfilled look or
Yes.
anything like that. It's again, that is more of a possible problem with fillers for sure. So yeah, I would say I wouldn't be too worried, especially again, if you're doing Botox with the right provider, you're talking about the right amount for you. You can make it look very natural, just soften a lot of the lines, wrinkles that start to come with time. So yeah, that's definitely a misconception that a lot of people have.
Definitely. And I feel like people shy away maybe from doing these treatments because of that misconception. So I just feel like that was important to address.
Yeah, the other one, the rat poison one, no, it's not. We joked about it, but it's not used as a rat poison.
Not at
No,
all.
it's
Not
a
even a
muscle
little.
relaxer. I've never seen it used as a rat poison.
Let's see, what other ones are on here that we can kind of go through? If you stop Botox, your lines come back worse than they previously were before you started.
Yeah, no, I don't think that's necessarily true either. Now, look, if you do Botox, at a certain age, and then like you stop it, and then like 10 years later, you're probably gonna have deeper lines just because of age and time.
You're
You're gonna
aging.
get deeper
That's a
lines.
natural process.
Exactly.
For sure. Let's see what else is
But
on
I
this
don't think
list.
there's like a rebound effect
No,
or something like
definitely
that
not.
from
It's
Botox.
not a steroid. You're not going to rebound anything. Botox is only for wrinkles. That's definitely not true.
That's not true.
Botox is used for so many different things other than just relaxing wrinkles.
Yeah. We should make an episode about that, all the other
Yeah.
uses of Botox and all
Because there really are so many.
Yeah, there's so many different things used for like migraines, headaches, sweating, so many different things. We can definitely like do an episode just about that.
Totally.
But it's used a lot for wrinkles, which is great.
I would say that's most commonly what it is used for.
That's what
But
most people
a
are
plethora
familiar
of
with it
other
for
things
for sure.
If I get masseter Botox, I will get jowls. I mean, that's depending on the patient, right?
I mean, yes, we want to evaluate each patient individually, but no, you can definitely do masseter Botox and be okay. Like uh, it's not like, you know, if you get master Botox, you're gonna get jowls like right away. No, that's
You have
not
to
true.
be with the right patient, though, the right candidate to do master Botox. Because if you do have like a fuller face in the front, I probably wouldn't recommend it, depending on the person, though.
Well, it depends on why you're doing it, because master Botox can be done to slim the face for aesthetic reasons, but it can also be done for people who are having issues with their TMJ, they're grinding their
Grinding.
teeth, and
Absolutely.
it's causing them pain and discomfort, and they just want to feel better and they want to get a little bit more comfortable with it. So,
That's why I feel like consultations are always so important before you do a treatment.
Mm-hmm.
That way you can determine if you're a good candidate for that treatment or not.
I'm trying to think what are some of the like really strange methods
That you
that
hear.
I've heard.
Let's see if there's anything else in here that's just like, these are misconceptions, but these are not Botox related.
Let's go.
Let's do it. Okay, dermaplaning leads to thicker hair growth. At-home microneedling devices are the same as an in-office treatment. Yikes, I hate that one.
Yeah, I mean, it just doesn't sound right, right? Just saying it. No, it's not. There's definitely, when we do microneedling here, there's medical grade devices that you're not going to get at home, at least not legally.
No,
You know?
definitely not FDA approved at home for sure.
Yeah, I mean, I guess you can go and steal one from a medical office and use it at home, but yeah, the stuff that we have here, you know, is gonna, like, there are medical grade devices that are only sold to, you know, medical offices that are not, you're not
They
gonna
require license.
exactly.
Yeah, absolutely. And not to mention, if you are doing this at home or attempting to with like an Amazon device, you don't know what depth you're doing it at. You don't know if you're doing it cleanly. What if you get a skin infection? There's so many different things that you can be causing if you're doing these treatments on your own time as if you're a provider when you're not.
Yeah, there's a lot of, there are certain microneedling devices that can be used at home, but they're not the same that are usually used in the medical office. Just like there's, you know, like home Botox, which I think is a cream or something.
Home Botox?
Yeah, but it does.
Oh.
It's not actual Botox.
Rub it on
so,
yourself?
Yeah,
Let's see what other ones we have on this list.
I'm not recommending that though.
No, neither am I. There is a right or wrong age to get treatments done.
There's a right or wrong client, you know, a right or wrong situation for each specific treatment. But no, there are treatments that you can start, you know, at a much younger age, especially if you're doing preventative, you know, medicine, as opposed to certain things where, like, you're not gonna get the same treatment when you're in your 20s as, you know, like when you are in your 40s or 50s or 60s or 70s. But no, this is a patient by patient
I also
case.
think this one too is like if I have a patient that's 24 years old and she said, oh, my friend is also 24, so if I'm getting this treatment done, she automatically should be getting this treatment done, and that's not necessarily true. Everyone is so individual.
For sure, yeah, absolutely.
We definitely all need to start doing things probably at different times. It's not just like an age cap, you know?
No,
Everyone must start Botox at 22.
We're the same age, right?
Yeah,
I look much,
we are.
I look much older though.
It's because I stress
I need
you
a
out.
lot
It's
more
all the
work
guys. It's all the coworkers.
than you do.
If you stop semaglutide, you will gain double the weight back.
Yeah, so semaglutide, Ozempic, these are very commonly talked about treatments right now for weight loss.
Definitely.
So that is a little bit different than like aesthetics and regenerative, but it's something that's going around. But yeah, I mean, look, weight loss, weight gain is a complicated thing. Definitely, these kind of treatments, these kind of injections can help. But it's not like that rebound effect that we've talked about. No, there's definitely, you don't have to gain, you know, twice the weight back or even the whole weight back, or you don't have to gain much weight back, you know, after, depending on what lifestyle modifications you do. If you continue with a certain diet and exercise, there is with certain studies that looked at these medications, a percentage of the weight loss was gained back, but again, that's
That was more from lifestyle choices that they made once they stopped the medication, not
well,
so
and
much the
that's
medication itself.
the average too. When you look at average, so everybody's different. Like in the study, like the average person, gained that much back, but it wasn't obviously the full way back. So these people still lost weight when they were followed up on the study, but at the same time too, it really depends on what you do after you stop it for sure. For sure. I mean, if you take a medication and you lose the weight you want to lose, but then you start like not being careful with your diet, with your exercise
Eating
again,
In-N-Out burger every
you can
day,
gain weight back.
You're
Yeah,
gonna gain the weight back, obviously.
but it's definitely not an automatic thing. It can be helpful for people who are trying to lose weight, and again, you have to be the right candidate for it. But if you take care of yourself after, you
The
can be
weight
fine.
should stay off. Here's another misconception. I can change the shape of my lips with filler.
I mean, there's a little bit of truth to that. We can definitely, when we do fillers in the lips, we can change the shape a little bit depending on where we add volume and stuff. But we're definitely, I mean, we are limited with the anatomy of the lips that comes in. So I've definitely seen exaggerated claims, online and stuff. And sometimes people come in with a picture of a completely different lips than what they have, and that's when you have to set realistic expectations. Can you do small changes? Again, within the confines of biology and physics and stuff.
Whatever
Sure.
their baseline is essentially is going to dictate the shape of the lips at the
Exactly.
end.
And sometimes you might need a couple sessions to get, to a certain shape or closer to a certain shape that they want. But you can't just erase their the lips completely and do a completely different shape,
Yes.
just like that.
That's probably a huge one too, is when people come in with photos of like celebrities saying that they want these lips. That obviously isn't achievable, and that is another point.
One of them,
actually.
if I do fillers, I look like Kim Kardashian or something.
If I get filler, I can look like Kim Kardashian.
I mean, maybe if you look kind of like her to begin with, and you're just missing a little bit of like
her
volume in the
baseline.
lips.
But I can't look like Kim Kardashian, even if I attempted. No filler, peel, laser. I'm not going to be able to look like her.
Yeah, no, it's again, you're limited with anatomy. Can we do certain changes? Of course. Can we enhance certain features? Bring certain features a little bit more. Sure, but we can't completely usually change the shape of a person. Not
Entirely, at least.
Yeah, and most people, they want to enhance what they have. Like most people come in, one of the first things they say is they want to look natural,
Yes.
but just maybe look a little bit more. The word that we hear them say, you want to look a little bit more awake. I feel like I'm tired all the
Refreshed.
time.
That's a word that we
Refreshed,
always use. Yes.
balanced, lifted.
Symmetrical.
Exactly.
All the things.
Yeah, but to look like a completely different person is not the way to go for most people.
Definitely not. What?
I don't think Kim Kardashian can look like me either, to be honest. So.
She probably can't, and I think she's jealous, honestly.
I don't think she's jealous.
Let's see what else we have.
Each person is unique.
As it should be, though. It gets a little bit boring when
Right.
everyone just looks like replicas of themselves everywhere.
Absolutely.
All right. What other topic is a misconception? RF microneedling melted the filler that I had in my face.
No, not typically. Honestly, the level where we place the filler and where we do the RF microneedling, usually we're targeting different tissues to start with. Now, sometimes after doing a treatment with filler, there might be a certain waiting period before doing other treatments just to allow the skin to heal and such. But just because you've had fillers before, because we hear that where people are worried that they can't do RF microneedling just because they have filler in the face and they're going to lose all that volume. And
I think there's a lot of misconceptions with RF microneedling devices in general, especially like this past year. I feel like there's just been so many things said about the melting the filler, melting the fat, causing more skin laxity after. Have you seen those? Or is that just
yeah, no, for sure. And maybe possibly because sometimes people, again, are not doing the right treatment, the right thing, just, but if you do it professionally, if you talk to somebody who's actually doing the right treatment for you,
who understands the depths and then, yes, the energy that needs to be used for every given area, then I think you're going to be safe for
and
sure.
personalizing the treatment for you. Because what I've seen, again, a lot of time where these problems happen if when you go to a place that like offers one thing and they just do it to everybody.
Yes.
They're not really,
Tailoring
choosing
it to you.
exactly.
It's not a one size fits all.
Exactly,
Yeah,
exactly.
absolutely.
So if you only have one tool and you're using it on everybody, including the people who shouldn't get that treatment done, then sure, yeah, you're gonna get some issues and concerns.
I know that I've mentioned this before, but we're just going to circle back to this point because it seems to be a hot topic right now. Botox kills the center for empathy in your brain.
Yeah, no, that's again another misconception that I've heard. I think where this is coming from is there's a lot, because Botox, what it does is it relaxes the muscle. So I think it's coming from a study where it shows like we have something called the mirror neuron, where when you frown, like I frown, or you see somebody doing a certain expression, you might do the same expression, and that might be true, because
You can't make that expression that
you're
well.
not making the expression. But to jump to the conclusion that that means that it kills the center of empathy in your brain is completely bogus. Yes, for sure you can still be empathetic if you.
I've gotten a lot of Botox and I'm the most empathetic person. If you get a paper cut, I might cry, honestly. Like, that's how empathetic I am. So I definitely don't think there's any truth to that whatsoever.
Honestly, there's actually studies that show that Botox can actually be great to help like reduce depression and anxiety and stuff. So a very positive effect, I would say, in terms of like mental health when it comes to Botox and stuff. So I wouldn't.
So not true.
Yeah, it's not true. If your partner or somebody is getting Botox, you don't have to walk away or something, because
all of a sudden.
it doesn't work that way, I promise.
Perfect. And I think that was we finally made it to the end of our list here, it looks like.
Perfect. Well, it was good having you.
Thanks for having me. It was fun.
Come back for sure.
You're probably for my shift tomorrow.
Awesome. Everybody who's listening, come back as well. We'll be here next week. Please make sure you subscribe, like, send us any topics you want us to talk about, and we'll see you next time.